Hi, Miguel. Welcome to the Power Talk Show powered by Business Talks Weekly. Thank you so much for joining a podcast channel today. It is an honor to have you. So, before we dive into a conversation, can you tell us a bit about yourself, your professional background? And I have one particular question I want to begin with. Why transportation is so important in the hospital industry?
Sure, sure. Well, first off, I want to say thank you so much for the opportunity to join you and your listeners to talk about non-emergency medical transportation. And I look forward to our conversation and to our discussion. So let me start off with a statistic. 1 in 5 Americans without access to a vehicle or public transportation skip needed medical care in the previous year. Think about that. 1 in 5 Americans. What's the impact of that? The financial impact of missed appointments in terms of cost to our US healthcare system is roughly estimated to be about $150 billion annually. That's in lost revenue, operational inefficiencies, and most importantly, worsened patient outcomes. So when you start to think about the fact that the lack of access to transportation and its impact on access to care, that's the reason why I am involved in non-emergency medical transportation, or NEMT. My background is that I've always been involved in working with underserved populations, or populations that are in need of services that may be geographically um, the inability for them to access care, or maybe it may be financially, or in some cases, it may be tied to just not having the support that they needed. And so that has been a passion for me in terms of how to solve those problems. So I've been in healthcare for the last 30 years. And while I was a student at Yale, I actually started a nonprofit clinic in an underserved community. And so that has consistently followed my career. And so after 30 years in healthcare, first spending some time at Deloitte and Ernst & Young in their public sector healthcare practice, and then spending 12 years running a organization called Mid-Atlantic Association of Community Health Centers, where we were committed to expanding access to care for underserved populations. Having spent that time and understanding what are the access to care challenges and understanding the role of transportation as a barrier, that's really why I came to coordinated transportation solutions. The fact that I can be able to support and develop strategies to try to address those concerns so that we can reduce that number from 1 in 5 to none. And so that's my passion here. And when you start to talk about the role of non-emergency medical transportation in terms of bridging the healthcare gaps, here's some interesting facts. Transportation is key for ensuring access to care for the vulnerable populations and vulnerable groups. Think about it. For example, older adults, like our parents, individuals with disabilities or chronic illnesses, low-income families, and most importantly, those that may live in rural areas or poor transit areas. These are groups that are in need of that transportation is able to help solve. In addition, studies have shown that improving transportation supports the improvement of healthcare outcomes and also helps to reduce costs. And here's how. The fact that we can ensure that individuals are not missing those appointments, fewer missed medical appointments can reduce unnecessary hospital admissions and readmissions, and hopefully lead to better management of chronic diseases, because that's a big challenge here in the United States. So, and then lastly, supporting independence and well-being, giving people the opportunity to be able to have the dignity of being able to access care in a way that best meets their need. That's the role that my organization, Coordinated Transportation Solutions, is focused on supporting. being able to give them the compendium of options and support so that they can get to their medical appointments in the best form and fashion that meets their capacity needs. And so, that is something that continues to drive me here as the CEO of this organization, and continues to create opportunities for how we're going to grow into the future. Because when you start to think about growth projections, the non-emergency medical transportation market is slated to grow to roughly about 13.3 billion by 2031. And they're seeing that significant growth tied to the increasing number of seniors that's a growing population in the United States, as well as those who are over 85. And so the ability of these individuals to be able to access transportation is going to be even more so. And so we see that as an opportunity for us as we not only within the industry, but also within our organization. And the other thing too is, you know, unlike our competitors, we are a nonprofit in this market space. And why that's important is because our mission is really to provide access to care to underserved individuals and communities. And underserved means not only low income families, but those who don't have transportation. So that could be, our grandparents. That could be in anyone within, it doesn't necessarily depend upon socioeconomic status, although our focus is on those who are underserved and may have some financial challenges. But again, we are committed to providing transportation for those who are in need. And so, as an organization, we work with health plans, we work with transportation providers, because we're a broker of those services. And so, our intent is to ensure that on behalf of our customers, we are able to coordinate their transportation spend and support them in ensuring access to care for their beneficiaries. And so as a broker, that's our role. Those are things that remain that drive us in making sure that we're providing patient-centered transportation.
That's wonderful. And thank you so much, Miguel, for such a brief introduction. I have a critical question in my mind. I think this is not a problem just in the United States. This is a problem across all country, all regions,
Mhm.
irrespective of ethnic place or anything.
Sure.
I want to understand, why is the government not able to put an infrastructure in place? What is the biggest challenge in developing an infrastructure for such a critical space?
I think a lot of it has to do with the investment in public transportation. Some jurisdictions are much more committed to providing the supports for that type of transportation so that that residents of that city or area can access all parts of the jurisdiction. That is really what is the driver for why there is a need for non-emergency medical transportation, because where there is very poor public transportation and there are areas where there are gaps in transportation services, that's really the role that we fill in meeting that
Sure.
need. And so that's part of the reason why there's opportunities. I know that your focus is on B2B. There's opportunities for entrants to enter this market to be able to meet that growing need. Because, again, as many governments are trying to best manage their healthcare costs, depending upon the population demographics, that for those with aging populations, the need for transportation is going to be more so. And so the opportunities for individuals to get into this business to be able to meet that need is quite great and will continue to grow, as I noted in our earlier conversation.
Absolutely. Miguel, like, you have been into the healthcare space for such a long period. And, whenever I have a discussion now with any healthcare profession, the first thing that comes to my mind is pandemic. How has pandemic changed the industry? We are long behind pandemic now. It's been almost 4 years, but how has it changed and how is the transition looking forward?
Sure. I think the pandemic has really impacted sort of how people access care and the role technology plays in accessing care. there will always be a need for transportation services because there's certain things that cannot be done through telehealth. I mean, you can't do a physical through telehealth. All right, at least not now, at least. And you can't do dialysis via telehealth. All right. But the reality is that what it has shown is the importance of access and transportation in supporting that access. I think post the pandemic, it's also shown us the fact that how many people are truly disconnected from access, being able to adequately access healthcare services consistently. And I think those are things that are creating opportunities for transportation providers like ourselves to be able to meet that need. And then, more importantly, what we have found from our existing customers and new customers is the fact that, they're recognizing if I can get um, our beneficiaries to come in for those preventative services, that we can quickly be able to diagnose whatever ailments may be emerging and be able to staff that off, then it helps to reduce the downstream clinical costs that may be much more larger downstream. And so those are things that we're finding that healthcare entities are realizing the importance of transportation and the need that is still out there to be met.
Wonderful. Miguel, I want to understand your process and your service delivery mechanism. Like, I want to understand how does a customer reach you or find you, and then how do you reach out to them? Where do you take them during their emergency period? And how does insurance come into play? Because, I
Sure.
believe insurance has their own hospital network. So, how does that come into a play when there is an emergency?
Sure. And again, remember, we are primarily supporting non-emergency medical
Yes.
transportation.
Yeah.
So, with that being said, how does a customer access NEMT services? Well, for those that here in the States, for those that have Medicaid, it is an entitled benefit. And so, depending upon the state plan, certain populations are covered for those services. And it's really driven by the coverage rules and eligibility requirements of the state plan for the various states. For those that have Medicare Advantage, which are our seniors, various plans offer transportation services as a supplemental benefit. And so that is one way that they can be able to access it for those that have plans that offer those services. So they really need to check their plans or identify Medicare Advantage plans that offer those services if that's what they need. So, how does someone, once they are identified, how do they schedule for services? That occurs primarily through a myriad of ways. An organization, a plan would subcontract their services to a broker like a CTS, in which we would then offer a compendium of ways for trip scheduling. That could be either by the phone through our call center. It could be either through an online platform on our website. It could be even through an application, web application. So there are myriad of ways that individuals can schedule a trip, and so, upon approval by the health plan for that assigned trip, that person can then is then it's then an assessment is done to determine what type of transportation. If someone has able to easily ambulate from their door to the car, that may be a service like a shared service ride or maybe a taxi that will be provided. If someone needs some assistance, like for example, if they're in a wheelchair, we may then provide a wheelchair accessible van. In some cases, if they may need a stretcher, we have stretcher services that we can provide as well. And then in some cases, individuals maybe need to be monitored as they're being transported. We also provide non-emergency ambulance to support those monitoring activities that may occur. It really depends. Our approach is we deliver care that's driven by the needs of the patient, and that is what helps to support the coordination for that services. In addition to that, one of the things that when we contract with providers to provide those services, you know, we're looking for individuals that not only are consistent in terms of prompt pickup and drop off, but doing so in a safe and reliable manner. And also being able to effectively communicate and understand when to escalate. Because again, when you're taking someone and then maybe someone may not be feeling well, the importance of having to be able to escalate to address a potential emergent concern is important. So having drivers that are aware and are capable of communicating concerns and being able to effectively make the trip experience one that is safe and that meets the needs of the customers as well. So that's the thing that we do here at CTS, and that's what is expected um, in terms of the business. One of the things I've talked
Understood.
about brokers, and I've talked about those that may provide the transportation. So I want to make sure that I'm clear for your listeners as to what's the difference between the two.
Yes, absolutely. And thank you so
So
much for that clarification.
yeah, so a broker is really an entity that is the facilitator on behalf of a customer or state, depending upon how the contract is situated, to coordinate the transportation services. And so, in some cases, brokers may have the transportation. Some of the transportation can meet some of the transportation needs, and then may contract for some of the more specialized services. But a transportation provider is really the organization or company that provides the actual transportation. And so, one of the things that we look for as a broker in terms of finding the right transportation provider, because going into NEMT business requires a number of things to be done. First off, it's the general licensing and certification requirements that are needed, and a lot of that is driven at the state level. So you need to understand what are both the state and federal regulations for licensing and certification. The other thing is understanding they must also have a national provider identifier for Medicaid billing if they're going to be providing Medicaid transportation. The other thing is that proper vehicle inspections and certifications, particularly to
Yes.
ensure American Disabilities Act compliance. That's something here within the United States that must be met and is a certification requirement. The other thing is having the adequate insurance and liability coverage, and that's set at the state level, and making sure that that liability can cover not only the vehicle but having enough insurance to cover in the event of an accident and those concerns. But most important is training, the ability to make sure that there are drivers that have been properly trained to know when to escalate if there's a problem, that is individuals who are sensitive and have customer service skills and emotional intelligence to know how to engage with customers in a friendly manner is key. And then also being able to ensure that these drivers pass, federal and state background checks is key as well. So these are things that are important. The ability to, our bill, our Medicaid and Medicare can be quite complex in terms of billing here for insurances here. And so, one of the biggest challenges in this industry is fraud, waste, and abuse. And so organizations like ours as a broker, we are constantly managing that to make sure that bills that are submitted reflect the actual service provided. And so making sure that the invoice reflects what was done. And so that's really the role of a broker. But in terms of as a provider, it's important that they also are able to audit their records because again, brokers from time to time will do site visits, will do audits to make sure that things are proper and in order as it relates to the expectations of the contract. I think the other thing that's really important as well is for entities that are looking to get into the NEMT business is really the partnerships, particularly the partnerships with hospitals, clinics, and other healthcare organizations, because many of these organizations are looking for entities to help them support their activities to get their patients discharged, making sure patients can show up for their appointments. So it's important that those partnerships in place, and that's really the role of the broker, is to make sure that there are the appropriate partnerships in place to support delivery of to a transportation provider to support the ultimate delivery of that patient to and from their respected destinations. And so, as I look at the overall business itself, There are a couple things that I think, your listeners may want to know in terms of just NEMT business. One is compliance is paramount. There are a lot of regulatory requirements in this business, and they can be quite complex and they vary by jurisdiction. Staying current on both state and federal compliance requirements is critical in this business. And as a broker, we're always on top of that. And so we are making sure that our providers are aware of what are the new requirements because they change from year to year, and so staying on top of that is key. The other thing is this is a market that will continue to grow, as I mentioned earlier.
Absolutely.
Demographic change around trends in terms of the aging population and increased chronic disease, the prevalence of chronic disease in our populations are fueling the demand for non-emergency medical transportation services. So there's going to be a lot of opportunity, particularly among the senior population. And we've talked a lot about for those that may be insured. There's a market of private pay. So there may be individuals that may not have Medicaid or may not
Exactly.
may have just Medicare but it doesn't provide transportation services. Advantage Plan doesn't provide transportation services. Well, there's a whole market for private pay. And so that is a growing market that many organizations can enter into. And we're seeing a number of subscription models that support that and a number of models that allow for that support the transportation needs for those that may not have an insurance product to support them on that. The other thing that I want to also leave for your listeners is operational efficiency is key. We're in a highly commoditized business where price drives everything. And so the ability to employ technology, particularly for dispatch, billing, and scheduling, is essential to remain competitive and to address the fact that it's a highly regulated environment. So technology is key. And here at CTS, we are looking and have clearly implemented technology as a core component of how we remain viable and relevant to provide that patient-centered transportation to our customers, and also ensuring that we're giving our riders the various options that make it easier for them to book a trip. So technology is key for that. And then also quality. That is key. Customer service is important. On time arrival, accessible and safe transportation are key in order to be able to not only build a reputation of trust, but it's necessary to maintain long-term contracts. So I think hopefully that provides some insight as to non-emergency medical transportation, sort of what is key and what are the drivers for non-emergency medical transportation, and more importantly, what are the opportunities? Because like I said, here at CTS, we are very much committed to meeting the need of underserved and unserved populations. And so there is definitely a bigger opportunity as you look at this globally. Because
Absolutely.
again, the need for transportation to be able to get people to their appointments is not something that's just unique to the United States. It's a global
Yeah,
problem.
absolutely, absolutely. So, Miguel, that's so interesting, and so while as you mentioned about opportunity, this market itself has huge potential, and it requires a lot of infrastructure to put into place, and it is a good for-profit business. What was the decision that you took? Was it a conscious decision to make it a non-profit organization?
Well, so to give you a little background on CTS,
Yes.
my predecessor, David White, who founded this organization, he had made the decision to set it up as a nonprofit organization because of a need that he saw. He had a family member who was experiencing some health challenges, and he understood the challenges of not being able to schedule regular and consistent transportation. And so as a result of that, that drove him to establish CTS to meet that need. And so, he decided to establish it as a nonprofit with the intent of focusing primarily on underserved or unserved populations. And so that is what has differentiated us because, again, we're driven by a mission focus, but at the same time, no mission, no margin, no mission. And so we are very much committed to making sure that we are reinvesting dollars to better support our mission in terms of enhancing the technology, improving the customer experience, as well as supporting our employees in delivering the type of care that we would expect if we were in the same situation. And so I came in, I've been with the organization going on 3 years now. And so I've come in with a vision of building on what Dave started and using that to help to increase access to care utilizing transportation as that driver.
That's great vision and great mission to look forward to and work with passion towards it. I have one final question, Miguel. I ask this to every one of my guests. What advice did you receive that changed your perspective at how you look at things professionally and personally?
I think when I first came out of graduate school, I had the opportunity to work for a gentleman who ran a large ambulatory network in New Jersey. And he impressed upon me the importance of using capital market principles to solve social problems. And that has been sort of my mindset because I'm a strong believer government can't solve everything for us.
Absolutely.
And the market, there are capital market principles that can solve social problems. And so that has been my lens that I've worked in every organization that I've worked in and led is to use those principles to create social change and to improve the lives of the customers that we serve. And so that has been sort of the lesson that I learned and that I try to instill here at CTS.
I have learned the same lesson through you now. It was a wonderful conversation, Miguel. Thank you so much for joining us today.
Thank you so much. All right, take care.